As of February 10, 2021, the Centers for Disease Control issued new guidelines regarding COVID-19 exposure for those who have completed the currently available 2-dose regimen of the COVID-19 vaccine. They emphasize that all vaccinated individuals should continue to exercise the same public health guidelines, including physical distancing, mask wearing. 2 masks are now deemed better than 1, as discussed by Dr. Bruce Y. Lee in Forbes, hand hygiene, and staying home with any sign of illness. But if a vaccinated person is exposed to a person with COVID-19 positivity or active infection, they can forego quarantine if they meet the following criteria. While it remains unclear whether the COVID-19 vaccinations prevent viral transmission or even infection, the vaccines have been found to prevent symptomatic COVID-19. Both symptomatic and pre-symptomatic infections are largely contributing to community transmission. This will be avoided following vaccination. As with all guidelines, there are caveats to the above. If a vaccinated person develops any symptoms indicative of COVID-19, they should follow the quarantine and SARS-CoV-2 testing guidelines by the CDC for unvaccinated people. Quarantine guidelines for unvaccinated individuals following COVID-19 exposure, or those who are less than 2 weeks beyond their second dose of the vaccine, remain unchanged. If one has close contact with an infected individual, they need to quarantine. Close contact is defined as being within 6 feet or less for at least 15 minutes, caring for someone with COVID-19 in the home, having any physical contact such as hugging or kissing, sharing eating utensils, or being exposed to a cough or a sneeze of a person with COVID-19. Quarantine includes any of the following. Options to potentially reduce this 14-day quarantine include, while guidelines for fully vaccinated individuals have loosened a bit, it remains reasonable to err on the side of caution. As new variants become more and more prevalent, the absolute effectiveness of the vaccines remains to be seen. While the vaccines very likely provide good or even excellent protection against new coronavirus variants, any sign of even the mildest symptom after exposure needs to be taken very seriously. Full coverage and live updates on the coronavirus.